Louisiana Living on Fox 14 continues.
And welcome back to Louisiana Living. Joining me today is Dr. Hardy Gordon with Louisiana Pain Care, and we're here with our monthly segment, Life Without Limits, and today we'll be talking about kyphoplasty. Thank you, Dr. Gordon, for joining us today.
Thank you for having me.
What is kyphoplasty?
Kyphoplasty is a procedure that we perform at Louisiana Pain Care. It is a safe, effective outpatient procedure, typically for compression fractures.
And who can benefit from kyphoplasty?
Typically we see compression fractures in the elderly, predominantly women, albeit it couldn't happen in men. We typically see it in folks that have osteoporosis. Usually around springtime or so, people get active. Unfortunately, they can develop compression fractures where basically the top of the vertebral body or the bottom crushes down, and it can be extremely painful. The kyphoplasty procedure is actually where we insert 2 needles after giving anesthesia and create a cavity with a balloon, and then we put bone cement into the vertebral body to basically fortify and stop the pain. The bone cement is the same thing that we use in, or not we, but the orthopedic surgeons use in a hip replacement or knee replacement. The patients see fairly immediate benefit. 80 to 100% of our patients typically get up, walk out, and oftentimes they'll give us hugs.
Oh, great.
Yeah.
So they can go from a very painful situation to pain-free?
Yeah, the compression fractures themselves are extremely painful. Oftentimes it presents with axial back pain, not necessarily the pain going down the legs, but pretty severe axial back pain. What we ask them to do is get in touch with either their primary care physician, or sometimes these people will end up going to the emergency room, and then they'll get in touch with us and we can schedule it. It's an outpatient procedure, typically takes about 20 to 30 minutes, and as I mentioned before, 80 to 100% relief.
And how long is recovery?
Usually it's pretty immediate. They're going to be a little sore after the surgery, but for the most part, they're in such bad shape prior to the procedure. When they get done, they're up walking around, and they'll be a little bit sore, but maybe through the weekend they'll feel a lot better.
How long does the cement last? Is it permanent?
It is permanent. Very safe, tried and true. Like I mentioned before, it's the same thing that they use in the hip replacements and the knee replacements. What it does is it actually fortifies the vertebral body. If I can use my props here. This is a normal vertebral body, and this is actually square, if you can imagine, more or less like almost like a cardboard box. But it's very fortified in the middle, and then as you can see here in the osteoporotic bone, unfortunately there's a lot of air. So typically what can occur is either the top of the vertebral body or the bottom gets crushed up. Now there are plenty of nerve endings in this bone, and just like any other bone in the body, it can be extremely painful. And what occurs is there's a little bit of micro movement. You don't see it per se, but there's micro movement there, and it's extremely painful with any type of moving around. And so what we do is we put 2 needles in, blow up a balloon, then put the cement in there, and it stabilizes it, and the effects are immediate.
That's amazing.
That's great. It's my favorite procedure to do, for sure.
And how can someone get an appointment with Louisiana Pain Care to ask more questions about the kyphoplasty procedure? Well,
just have either primary care provider give us a shout, and or our number's 318-323-6405. We'll be happy to have one of our staff talk to them and talk to the patient and see about getting an appointment. Certainly if somebody goes through this, we want them to get in as soon as possible and get the relief they need.
Could this actually be a procedure where someone who's used to being on painkillers get off of painkillers? And
oh yeah. But I mean, it's an acute problem that can last for up to a year. I mean, and so, obviously if they are requiring pain medicines, if we do the procedure, then, we can certainly wean them off.
And tell me some of the other procedures that you offer at Louisiana Pain Care.
We do quite a bit. We treat pain in cervical spine, which is the neck, the thoracic spine, and then the lumbar spine, and we also treat multiple joint pain. But typically what we offer is epidural steroid injections to try to decrease the pain in the cervical, thoracic, or lumbar spine. We also help for sciatica. We do cauterization of nerves to alleviate pain, and we try to avoid writing pain medicines, but sometimes that does occur. But the procedures that we provide are to get patients off of pain medicines.
Great. Well, Dr. Gordon, thank you so much for joining us today.
Yeah,
It's
thank
great
you for having
you.
me.
And we'll be right back after these messages.